The American Medical Association's latest survey shows that 81% of doctors are using AI in practice today, and that's more than double the rate from 3 years ago. But the same technology that helps a physician finish his charts could also let a bad actor create a deep fake of him endorsing supplements he never heard of. And the chatbots that can answer a late night question for a worried parent are also telling vulnerable teenagers things that could get them hurt. AI has arrived in healthcare, but who's going to set the rules and how fast? Welcome to CareTalk, America's home for incisive debate about healthcare business policy and innovation. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the chairman of UConn Health.
Our guest today is Dr. John Whyte. He's CEO of the American Medical Association. He took over the country's largest physician organization back in July 2025 after nearly a decade as chief medical officer at WebMD. And since taking that role, he's put AI squarely at the center of the AMA's agenda. John, welcome to CareTalk.
Gentlemen, thanks for having me.
So as I mentioned, you came to AMA from WebMD and you'd spent a decade or so there helping tens of millions of patients turn to screen for medical answers. They're trying to figure out what to do there. And I'm wondering what you saw from that experience that carried you into this new job.
Yeah, I'll also add, up until I took this job, I saw patients for over 25 years. So it really was this combination that patients have always wanted more information. And at WebMD, we really talked about that better information does lead to better health, but the source of the information matters. So it was a recognition that patients go online to seek information, and we have to meet patients where they are. So it may be different, that they may not be putting it in to a box that's a search tool. They may be putting into generative AI or a chatbot. So we have to meet people where they are, but we have to provide guardrails.
How are we going to do that, Dr. John, when we've got so much happening so fast? I mean, if you believe the headlines, 81% of all doctors are already using AI. The rest are probably not being straight about it. I mean, it's sort of embedded in everything we do. How do we put guardrails when you've got people, when basically the consumers and the healthcare establishment are kind of running faster than we've even started to sort of think through what the boundary conditions are?
There's so much to talk about, John, and I would argue that we haven't even scratched the surface of the power of AI. So when you referenced our study about the number of doctors that are using AI, right now, that's mostly ambient listening, right? It's going to generate a note for the chart and for the patient, or it's going to help with a denial letter relating to prior authorization. What's really the value is, how is it going to help me diagnose you sooner and more effectively? And how is it going to allow me to provide you a more personalized treatment? But here's the thing. I don't know how these tools are developed. I don't know what their algorithms are based on in terms of their data set. So when we talk about guardrails, we have to have transparency first in terms of how are these tools developed. Part of the challenge here, I'm going to be honest, is that tech is controlling how things are utilized in healthcare. And I would argue it should be the medical community that is saying, here's the problem, let's have tech help solve the solution, and not tech saying, here's some fancy tool, let's go find a problem.
Well, just as a follow-up, David, Dr. John, the challenge here is that the technology itself doesn't allow you to actually the agentic AI is currently engineered using deep convoluted neural networks. The process by which the probabilistic algorithm works doesn't necessarily allow you, as the Europeans had hoped, to backpropagate exactly where the logic is behind before you even get into the data sets of where the answer is. And yet the answer for most of us appears to be pretty accurate, and more accurate than the Google machine that we've all been relying on. So how do you get at that tech infrastructure when it's the ultimate dark web?
Yeah. Well, I'm going to quibble a little with your characterization. I don't know if the data are better. There's some conflicting information on that. We know there's a lot of hallucinations where these AI tools actually give you the wrong answer. We know that some of the chatbots can try to ingratiate themselves to you. So I'm not so sure that's better. But here's one potential solution that the AMA talks about. We often refer to these tools as augmented intelligence. Let them help me make a better decision as a doctor, but they're not there to replace my clinical judgment and quarter of a century of seeing patients. That's where there's a big difference, that patients and others want to utilize these in lieu of a physician. And I'm saying they should help me make a better decision because I'm going to have a better sense of whether they're hallucinating or not.
Let's go down that path a little bit. I know AMA has sent letters to Congress asking for federal guardrails, especially on AI chatbots and mental health, and maybe to the point about augmenting versus replacing. I think one of the things that your letter is asking about is to just have the AI disclosed that it is
Yeah.
AI and not present itself as a licensed clinician. Is this really an issue today?
Absolutely. And all of us have used chatbots in other areas of our life when we're trying to return a package or complain to the airlines. And I'm going to be honest, I've used them. And sometimes I'm like, I'm not sure if I'm talking to a human or not. That's how good they've gotten. And you think, oh, of course, people would know if we're talking about mental health issues that they would know they're not talking to a chatbot. The data shows that's not true. So they have to be transparent about whether you're actually talking to a human. That's item number one. And then these tools, if they want to say that they're a licensed practitioner, then they should be subject to licensure. But no one thinks that's a good idea. There has to be a human, a physician in the loop. And those are some of the changes and actions that need to be taken. You mentioned deep fakes. You mentioned it early on at the front. People steal your identity as a physician, and they're not there to promote some healthy alternative, as you alluded to. They're there to promote some unapproved product, some magic pill, some supplement, some concoction that is going to make you live longer with no evidence.
In this environment, do you see a path where Congress or any leaders in the White House are going to actually demand the kind of transparency and clarity of the separation between the human and the machine that you're looking for?
Right now, the focus typically of the administration is not to have too much regulation. And there's always a debate, do you regulate before you try or do you try before you regulate, right? We want to promote innovation, but we also want to protect against potential harm. So where we have focused a bit is where is there common ground on regulation? So for chatbots, it's particularly there for minors, right? Their emotional intelligence is not the same as an adult. So we should have disclosure. We should have transparency. We should have escalation that if they're expressing suicidal ideations, that they're connected to a real life health professional. I'd like to see industry come together and really adopt responsible use of AI. Let's work together in trying to develop benchmarks. Let's talk about what a medical device is and the regulatory pathway of some of these wellness apps, which I think are more along the lines of a supplement and could potentially be harming patients. That's what this is all about. This is about patient safety.
So you talked about the federal side and then industry getting together. Meanwhile, the states are doing things. So you mentioned, suicidal ideation. I think California actually requires chatbot developers to monitor for that. Illinois has banned AI for therapeutic decision-making. Pennsylvania has a lawsuit against character AI for impersonation of a licensed medical professional. How do the states fit in with that? Is federal preemption essentially required, or is states also a relevant pathway?
Well, you alluded to there is an executive order that apparently preempts states from getting involved. I'm not sure if all the states have been listening to that because you've given some examples where states have gotten involved. And the challenge with that potentially is you could have 50 states with 50 different policies. I'm not sure that's helpful to the medical community or to the patient community. So we want to work with the states, and states ultimately are the practice of medicine. But let's take an example of a pilot in Utah where there is autonomous prescribing. FDA could get involved and say that's a medical device subject to a different level of regulation. And then that would preempt the pilot from continuing. We could talk about standards in terms of licensure. And we've talked about that in JAMA network in terms of if these products want to say they practice medicine, they should be subject to licensure.
But John, are they really saying they're practicing medicine, or are they glossing over that line?
Honestly, I think it's playing a little bit of both ways. If you want to say you're renewing a medication, I don't see how that's practicing medicine. That's my opinion. There's a lot of work that's involved in deciding whether or not a medication is renewed. But they want to say, oh, it's just renewal of a medication, and these medications are low risk. I've worked at FDA. There's no medication without risk. Aspirin, over the counter, that has risk. This is patient safety issue. So that's the challenge. It's the same thing on wellness apps. You want to say, I'm not a medical device. I'm not diagnosing a condition or trying to treat. But then they give you these dashboards. We talk about your sleep score. We talk about well-being. People interpret
your
that
real
to mean
age or
something else.
whatever. I mean, the whole, no, it's
Heart health.
it's-
What does heart health mean, John and David? What does that mean?
well,
Okay.
we're not going to take on the doc on that one.
Yeah, I got it. Give me a second. I got to type it into the chat bot, and I'll tell you.
There you go. There you go.
Can we circle back a little bit more on the survey of physicians? Because you note that things are just in the infancy of how it's being used, but I think there's also been adoption of other technologies, and physicians have that in mind, both in their professional lives and in their personal lives.
Yeah.
So I think there are about 40% of the physicians in the survey who are equally excited and concerned. There's a lot worried about skill loss, and then a lot worried in particular about students and residents, and worrying, hey, like I know how to do this, but are we training the next generation who won't be able to practice without AI? I mean, I think there's a lot of complicated questions within that one.
It's kind of like a glass half full versus glass half empty. So I'd say that 40% that see something positive, that's actually an improvement of what it was just a few years ago. So I think more and more physicians are seeing positive elements of digital health and AI tools. And I do think there's a lot of optimism, and these tools can be very effective. But at the same time, I think people are seeing, I have to take a cautious approach because there is risk. So let's take that example. I, as a physician who has practiced for decades, if I'm using a tool that can help generate a note, what about if I'm early on in my training? Will I ever learn how to take a patient history if I simply use an AI tool to do that? So that's a real risk. And that's why I'm proud that the AMA has been supporting AI in medical education grants to figure out how do we best utilize it. Look, AI is here, and physicians are using AI, and they're going to continue to use AI, as I think they should. But we have to have the framework and the guardrails, and this is where physicians need to lead.
When I listen to you carefully, Dr. John, it seems that you really would like a bolder, clearer line from the federal government around a regulatory framework that would protect and enhance the role of doctors and protect and support patient safety. Is that kind of the direction of travel? Because because I think the public, right and left, agrees with you and is ahead of actually our legislative or White House leadership in DC. Because you look at the surveys and you're watching some of the activity in the state legislatures, and that I think represents a lot of public fear and concern that isn't necessarily focused on healthcare, but people understand that these tools are quite powerful. I mean, is the AMA going to take the lead here? Because I do think that you're moving in a direction of real leadership here that I think a lot of people would look for and support.
The AMA is definitely leading in how we think about the use of AI in healthcare. And everyone would support that physicians should be leading in this space. Now, I'm not sure if there has to be federal or congressional regulatory action. What I think there needs to be is a framework. Now, it would be great if the tech industry and the patient community and the physician community can all come together and set voluntary benchmarks or standards and talk about the rules of the game. That's always best to try that approach. But I think you have to think about, is there a role for regulation? I think there is, but we still have to fine tune how much we need. Part of the problem is, as you alluded to, there are some bad apples. People are making it marketing claims as opposed to clinical guidance. And this is where physicians need to lead here, along with the rest of the clinical community. And there's different ways to get that done. Federal regulation isn't the only way.
Can we talk about the impact of AI on the workforce? Because if you look at the economy overall, there's a big concern, there's not going to be jobs for graduates, people won't have things to do. And yet, if we wind back to the last 20 years of talking in healthcare, it's about, physician shortages and shortages of other clinicians. So in a way, and one way that the physician shortage has been dealt with in that time frame is through the expanded use of PAs and NPs,
and immigration.
Immigration's gone the other direction, right? So you're going to also have, workforce issues are going to be presumably made worse by lower immigration. So where do we stand now in terms of physician workforce, and where do we take it with AI?
You're right. There is a physician shortage. There is a nursing shortage. There's a pharmacist shortage. The AMA supports everyone practicing at the top of their license. But beyond that, if you want to practice medicine, you should go to medical school. That's basically how we look at things. And everyone wants to call themselves a doctor, but everyone should go through the rigorous training, including residency, that one needs to practice medicine. Now, I do think we need to address physician shortage. And is there a role for digital health and AI? And I think there could be. And these are the discussions that we need to be having that we haven't had. What is the role of agentic prescribing and under what circumstances? What are the role of chatbots in mental health? There's not enough mental health professionals. So how can they help in anxiety and depression, and under what parameters? I don't know what the answers are, but this is the time that we need to be thinking about it and coming together. We're not going to churn out more clinicians in any short period of time, but how can we more appropriately triage patients, more appropriately diagnose so they don't have to undergo as many tests, have more personalized treatment, that we don't waste some time on treatments that patients don't need. That's where I think we can address some of these issues of shortages.
Let's talk about the evolving role of the patient relative to the physician. So I think in your survey about, half the members say they don't want patients using AI to interpret their own radiology or pathology results. But where's the line between empowering patients to advocate for themselves versus patients, self-diagnosing into a harmful situation?
And as I said, up until a few months ago, I still saw patients. Patients are utilizing these tools. We can't pretend like they're not doing it or they're going to stop doing it. What we have to do is help them use these tools effectively. So these tools should not be used to replace a physician's judgment. But I'm okay when patients have looked at labs first or radiology tests before we have, and rules have allowed them to do that they get them at the same time. These tools can help them think through the diagnosis, not automatically say this is what you have or this is what you don't have, but it can help you develop a list of questions that you could talk to me about. It could help you develop a list of a differential to go over with the physician. So we should have the opportunity to be able to talk to patients about that. At the same time, the visits are more and more compressed. I'd love us to be able to have more time with the patient to go over their test results and lab results. But I think AI can play an important role here to help patients have a more productive discussion with the clinician.
John, last question to you.
Yeah, I'm still looking forward, John, for you guys to set up the guardrails. Do you sent letters, I think, to 3 congressional committees on a really important issue, the use of chatbots in mental health. 1 in 6 adults in America leverage them in some form or fashion. Yeah. There aren't guardrails there. Don't you think there's a role for the AMA to lead here and perhaps provide the guardrails, or because I'm more confident in you than I am in Congress.
Thank you.
To come up with views on safety and how to handle these things.
This is what I would say, and we just sent those letters out a few weeks ago. That's not all we do here. That's not my approach. Send a letter and then I'm done, check it off and move on. We are working in a bipartisan way to actually work with the Congress, to work with the executive side, to say, how do we address this? So we're interested in, as you pointed out, we want to have disclosure and have mandated disclosure if we need that. We want to have escalation, particularly for minors, that if they're exhibiting symptoms of suicidal ideation, that it's going to be escalated to a human. It's always nice first to try to have everyone do it on their own. But if not, then that is the role of regulation. And we're actively working with the Congress in a bipartisan way to address the issue of chatbots as it relates particularly to mental health.
Well, that's it for yet another episode of CareTalk. Our guest today has been Dr. John J. Whyte. He's the CEO of the American Medical Association, and we've been catching up on the latest and greatest in AI. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the chairman of UConn Health. If you liked what you heard or you didn't, we'd love you to subscribe on your favorite service. And Dr. John, thank you for your leadership and thanks for joining us on CareTalk.
Absolutely. Always happy to chat.